But to answer your question about treatment, I mean, first and foremost, I'm a little bit biased. To get my PhD, I was kind of forced to do 7 years of clinical training. So I was a clinician and I worked with people with all sorts of mental illnesses, including social anxiety. And really, there's not a lot of ways that you can replace the value of one-to-one therapy work. Now, that said, we have a mental health crisis in this country where we have many more people who need treatment than there are people who can treat them. Therapists have waiting lists, and some people don't have health insurance or access to therapy. So in the absence of therapy, there's a few different things people can do. The first one is identify, and this is a little bit painful, but a nice starting place is identify all of the ways social anxiety is messing up your life. What is it doing? In what ways is it getting in the way of living the life you want to live? Is it getting in the way of relationships, work opportunities, everyday socializing, everyday errands, like, going to get your hair cut? Once you have a sort of inventory, you take stock of the ways in which social anxiety is messing up your life, well, then you use that first as your motivation, but really as your guide to challenging that. So if, for example, social anxiety is interfering with everyday errands, then you want to build a plan to systematically expose yourself or engage in those behaviors. So the real treatment for social anxiety isn't to try to prevent rejection, it's to try to foster social courage.